that's actually the right time of day to go to the doctor. I didn't know that there was a good time of the day to go to the doctor.
Yeah.
But apparently 9 a.m. is it. I don't know why. So we're going to ask an actual doctor. Dr. Yoon's back with us today. Hi, Dr. Yoon. Come on. So, you know, you work in dermatology, but in every discipline, is it really better to go to the doctor at 9 o'clock in the morning?
It is.
Why?
Yeah, there are 3 big reasons, and we're going to actually list them out for you here.
Okay.
The first thing is that doctors are more fresh in the morning. Now, we all have circadian rhythms, okay? Circadian rhythms are kind of our sleep-wake cycles, and there's proof that in the mid-afternoon, our circadian rhythms dip. We get the mid-afternoon sleepies. And as you know, that also depends on what you eat for lunch. You know, a bowl of pasta is going to make you more sleepy than if you eat protein and fiber for lunch. Even doctors and nurses get the mid-afternoon sleepies. Second reason is that we have time issues, okay? Now, doctors, believe it or not, we run late sometimes.
No kidding.
Way. Believe it or not.
No way.
Yes.
Oh, yeah.
So if you have a procedure done, if you have a doctor's appointment in the morning, you're much more likely to be on time. Plus, your doctor's much less likely to be kind of stressed for time. And then the final thing is that, and this has never been 100% proven, but a lot of doctors and nurses believe that it's more painful to have injections in the afternoon than in the morning.
I've heard this before. This
Yeah.
really
It hurts less?
It hurts less in the morning than in the afternoon.
I
12
have
to
actually
3
heard
p.m.
this before from
Yes.
healthcare professionals.
Yep. So speaking of needles, I actually did a procedure on a person this morning.
Oh, yeah, we should mention that every time Dr. Yoon's here, he tries to help out, graciously, one of our viewers or audience members with some sort of issue. Do you want to start with the issue or what you did?
Well, we can start with the issues.
Okay.
So one of the ways that we age is that our faces lose volume, okay? And so the way I describe
I could
it...
give up a little of these cheeks if you need them for somebody else.
So that's what we treated Nancy for. She is a woman who came to see us, and she said, look, I've got these cheekbones that I've lost volume. I feel like I look tired, and we treat her with Juvederm Voluma today. And this is my favorite injectable treatment.
Oh, that's a big needle.
Big needle.
Actually, that's
Now-
a cannula. It's not even a needle, okay? It's a cannula like we put like in an IV. There's no sharp end to it. It is completely
Really?
painless when you inject this.
Are you kidding?
What?
It's painless.
Well, okay,
Swear.
she
We'll
looked
ask her.
pretty peaceful, right? Did you give her a cocktail or a knockout
nothing.
drug?
Beauty.
No.
Wait.
Now, it wasn't in the morning, so it hurts less in the morning. But
Beauty is pain.
Beauty's
Beauty is
Not for
painful.
her.
But not with Dr. Yoon.
So we did. It's called Voluma. It's an FDA-approved injectable to fill
And
out
this
and
is your
lift the
favorite
cheeks.
thing?
My favorite injectable today.
Now, is
yes.
it just for cheek area? Or what is it? What is it used
It's
for?
FDA approved for the cheeks. That's what we use it. So it's to lift and to fill out the cheeks.
So it's specific for this part of your face.
Exactly. Yeah, you don't want to inject it into the lips or other parts of the face. It's not approved for that.
Okay, well, let's. Do we have like a before and after? You did this procedure
Yes.
earlier,
Yep,
right?
and we can have her come on out. Let's take a look
That's
at
the
her.
before,
That's her
and then
before.
come on out. Very pretty woman.
I am thrilled.
Unbelievable.
I
Do you
know.
love it? I mean, you're such a pretty lady. And the first picture, I'm like, what is she complaining about? She looks great.
That's great.
Wow, that's a huge difference.
I'm thrilled.
Now, he was saying that the instrument that's used with this technique is not even a needle and that it's relatively painless. Is that true?
You know what? The discomfort was minimal. And as
Wow.
I was saying to Dr. Yoon, I find it more difficult to go to the dentist and do that. So,
So it was relatively painless. You're
Yes.
very happy with the look.
very happy.
It's very dramatic.
The
It's
results
non-surgical.
They last up to 2 years.
2 years?
2
Yes,
years?
yes. So
Shut
she's
the
gonna
door!
She's going to have these cheekbones for the next 2 years.
I know. I
Wow!
am absolutely thrilled. It's like a whole new me.
And this is how she's going to look for a long time. And we just injected her about an hour or two ago.
Are you
And-
kidding
Are you
me?
kidding?
Yeah, almost no
Are
swelling.
you not amazed?
2 years.
2 years.
And you get 2 years out of it. Can I ask, I know it's different for case to case, but just
Yeah.
generally, what sort of cost a person is going to incur with
So
this?
because it's an invasive treatment, you have to have a doctor do it. So you want to make sure it's a board-certified plastic surgeon or dermatologist.
Absolutely.
Each syringe costs anywhere from $800 to $1,000.
Depends on how much you need.
Exactly. But it's a lot cheaper than surgery. You know, 10 years ago, all I would have to offer her is fat injections, and that's operative surgery. That's 2 weeks downtime.
cut you, yep.
$7,000.
Right.
Much easier way to do it nowadays.
You look great, honestly.
you. Thank you
Congratulations.
so much. Thank
Coming up next, the best